Dr. Correct, you also do orthodontic work. Basically, you're straightening out the teeth. There are definitely a couple very different procedures on how to do that, achieving the same results. Tell us about them and what are the benefits of one versus the other?
Nowadays, definitely. Nowadays, with the availability of technology, we're able to create from a digital model of a copy of the person's teeth. We're able to create something called Invisalign or ClearCorrect. And these are clear liners. A lot of adults are not very receptive to using conventional braces. In other words, the metal braces that we know, or even the white ceramic braces that have the same shape as the metal braces. A lot of people as adults are very reluctant because of their professional lives. So now we have something called Invisalign, ClearCorrect. There's a few other brands out there, but those are the two dominant companies. And they're very similar on how they work, but they're essentially clear liners that go over the teeth that sequentially will align the teeth, get them into the right position. And all what people will see, or whoever's in front of you, they'll think that you're whitening your teeth, or having a bleaching tray or a mouth guard. They won't even notice that you're using them. So it really works really good for adults. I would say that there are certain cases that lend themselves to each type of treatment, but overall, for a vast majority, they're interchangeable. And the benefits are now with the available technology that treatments can be shorter because we have more information available that we can use, similar to all the technology that's out there.
I see. So you mean patients do not have to go necessarily 2.5 years anymore. The treatment is shorter, and okay, well that's really good. And so tell me, so on this Invisalign, so you really say that they are basically invisible, and
clear, completely clear.
Normal talking distance, most people won't notice.
I could be wearing them right now and talking to you, and you wouldn't even notice them.
Wow.
You would have to go. You would have to do a close up and really lift my lip to be able to notice it. We could be talking, and you could literally not notice them. That's how convenient they are.
Wonderful. Let me ask you. Let's just say a person is nevertheless very high sensitive and very conscious, and goes, maybe my new boss, where I'm going to have an interview today, or the new girlfriend, boyfriend, and maybe they notice. And let's just say he, for some reason, skips it that day, doesn't put it on.
Perfectly reasonable.
Will that ruin the whole treatment?
Absolutely not. That's perfectly reasonable. And I always tell people, listen, you're a professional. If you have a meeting and you have some concerns that thing is going to get in the way, and you have a very important chat, that's why these things were made in the first place. You're a professional. You need to take it off. You need to take it off for a few hours or a day. Listen, it's not going to ruin the treatment. The teeth are not going to move immediately back to where they were. Just make sure you're compliant most of the time, or a certain level of time. And I mean, that's the nice thing about those clear liners. They're very flexible.
Wonderful. Well, thank you very much. Very informative, Dr. Correct.
Yeah, thank you.